and evaluate shade match. Let us apply different cervical, body and incisal shades in cervical, middle 1/3 and incisal areas respectively. After application, let us cure them. As we see this color palette, there are many different composites matching different areas of the tooth. This is a translucent shade required to increase the depth of the restoration. We will retain shades that match and remove the ones that do not blend. We are going to use thick tapering round-ended diamond burr. The teeth will be prepared buccally in these areas. Similarly, teeth will also be prepared lingually in this fashion. Now the tooth is prepared starting from buccal to proximal, giving bevel. Other central incisor is also to be prepared same way. The teeth are washed and they are dried. A gingival retraction cord number 000 is placed in the sulcus. It is first tucked at one end and then gently fed into the sulcus, first buccally and then lingually. Cavity cleanser is applied all over the tooth, first buccally, then lingually, and then the tooth is dried. Now the etching gel is applied. It should be extended just beyond the bevel and is applied on buccal, proximal and palatal surfaces. The gel is agitated gently with the brush. The etching gel is sucked out by using high vacuum suction. The teeth are washed and dried out completely. We are going to use single bond 2 adhesive from 3M Espe. 2 drops are dispensed in the well. The applicator tip is submerged in the adhesive. Bond is first applied on buccal surface, then lingually. It is important to apply the bond on the proximal surface using the brush. The solvent is blown away with a stream of air. Now the adhesive is cured for 10 seconds, first on the buccal, then lingually and then on the proximal surface. The mylar strip is placed to build the proximal wall. You can slide the strip slightly into the sulcus very carefully. Opaque composite is applied proximally, just short of incisal edge, pushing all the way lingually. It is cured for 20 seconds. The second layer of composite is applied and the P1 instrument is used to create depression so as to blend the next layer of composite. Cured for 20 seconds. 3M is used for gross reduction. The next medium polishing disc is used for finishing. It is important to finish the lingual surface also. Dental floss is passed through to check for the contact. With the little pressure the floss is going through. An articulating paper is used to check the high point in centric as well as protrusive movements. Football-shaped carbide finishing burr is used to adjust the high point. Now the fine polishing disc is used for polishing. We also need to polish the lingual surface. Finally, the superfine disc is used to polish the restorations. The polished restoration is washed and dried to check the surface. The etching gel is applied all over and agitated gently. And with the use of high vacuum suction, it is sucked off. Tooth is washed and dried. An unfilled resin is applied as final sealant. The excess amount is air dried and it is light cured. This is the post-operative view. Look at the invisible margins and the perfectly blending shades. Now you don't have to ask Santosh to smile. He smiles naturally. There is